more dull or more curved. Anterior side, more sharp. This. So you know, so if this is the anterior side, then this is the posterior side. Even if it's like that, you know that if I imagine it like this, it's the left lung, right? In the right lung, the same, more curved, posterior, more sharper anterior. So even if the position is like this, I know this is the sharper one, the curved one. So if I imagine like it like this, so this is the right lung. That's it. Easy lang, right?
How do we name the secondary bronchi? Here.
Here,
Under the pulmonary artery. This one.
here.
Yeah.
Actually, in the left lung, because there are only two lobes, especially in two lobe lungs, there are only two lobar bronchos. Because this is the main bronchos. So first, main bronchos, lobar bronchos, then bronchioles. So you cannot see the bronchioles na, especially if like this. So only in the hilum you can only see the main bronchos. So this is not the main bronchos because this is already cut, right? So going up, this is the superior segment, man, superior lobe. So that's the superior lobar bronchos
Secondary, superior, lobar bronchos, the left.
of the left now. Or you can just say left, superior, lobar bronchos.
Okay. Superior, lobar.
Para
Secondary.
diretso na bronchos, lobar, because the lobar part is the one that that is the secondary one. Because main bronchos, ano ram yun na siya, isa ram yun na siya. So from the trachea going down, will bifurcate into two in the carina. You know what the carina is, right? It's like the middle of the trachea. Trachea bifurcate, carina in the middle. So that's the carina. So as it bifurcates, it becomes the left and right main bronchos. That's the main. So that's the from the trachea. So as it goes deeper in the hilum, it becomes lobar, then bronchioles, then terminal bronchioles, then respiratory bronchioles. You know na, it's in histo na. So lab exam lang. So this is just the lab exam. So you just answer what you see. They cannot point what they can see, right? So only the gross things. Gross means what you can see. So gross is this one. So these are this is very prominent. So what's this?
Pulmonary vein.
Vein.
Pulmonary
So you know that there's only one artery, so you cannot say that this is a vein. So it's just three holes, because actually the vein will come up like this, going to the heart will come up. So this is the left inferior pulmonary vein. Okay, left inferior pulmonary vein. So artery, more posterior. So if you think it's more posterior, that's an artery. If it's anterior, that's a vein. So like this, if it's like this, anterior. This is anterior or inferior, that's a vein. Posterior or somewhere in the near the bronchos, that's an artery. Okay, so they will also point the grooves. So this is a groove for this one, ascending aorta. You should, or it's okay if you don't want to answer descending aorta, more specific, thoracic aorta, because there's an abdominal aorta po. So lower than this, after the hiatus, that's an abdominal aorta na. So in the lungs, it's specifically a thoracic aorta. They won't let you answer aorta because there's an arch of aorta, there's a descending or thoracic. So this one, and then
Posterior and descending. Sa posterior and
descending.
Dito.
Doon sa anterior and
Arch of
Arch, and then ascending aorta. Ascending aorta, more, di na siya mag-prominent sa lungs, more on the heart na siya. So during the heart part, that's where you will know. But the grooves here, as you can see, only this one is the prominent one. And then also the cardiac notch here, di ba? This is the cardiac notch. is somewhere here. Because you know that the heart is facing the left unless you have dextrocardia. But I don't think that there's a cadaver that has dextrocardia. So, assist, cardiac notch is in the left. Then somewhere here, so you know that this is the arch of aorta here. So what goes out? There are 3 arteries that goes out, right? So this is the left man. So from the left, first artery that goes out, brachiocephalic of the left brachiocephalic artery. But I think they won't ano na the old terms, because the old term is innominate, right? Innominate artery. So they will only brachiocephalic artery, and also the vein. Okay, so you don't name it innominate na. So this is the brachiocephalic, because this is in the left lung. I think they won't specify if it's left, just to be sure na lang put left brachiocephalic, then it will bifurcate again, but it won't be seen here. So like this, so the grooves, you know, more curve, posterior, sharp, anterior, groove, ascending or thoracic aorta, and ascending arch. They won't point if it's very vague. Let's say like here, so it's in the middle of the ascending and then the arch. They won't do that. They will put it in the middle of it. So if they want you to answer thoracic aorta, they will put it here. They will tag it here. Okay? So the more easier for you to ano. But don't be fooled if there's a, let's like this. There's still an impression of the aorta in the right, but it's not so prominent, unlike in the left, because you know that the aorta will go to the left, right? So that's the here. More on that. Okay, so that's it. So onto the hilum. So you know that the hilum is in the middle. So that's the entry of everything: bronchus, artery, vein, and also the bronchial arteries. Only bronchial arteries, no bronchial veins, because as you know in histo, right? In the anatomy, the bronchial arteries in more, right? The bronchial arteries will go to the pulmonary veins circulation, right? So there's no bronchial vein. If you answer bronchial vein, immediately wrong. No exceptions. But normally the bronchial veins are here. It's near the bronchus. There. You see that small hole? That's the bronchial artery. So more nearer the bronchus. It's like it's beside the bronchus. Bronchial arteries. That's very small. That's just a small artery. Unlike the pulmonary circulation, it's big. But bronchial arteries function is for the oxygenation of your parenchyma, of course. Even if the lungs is the one that's getting the oxygen, they still need the blood supply for oxygen. Okay, so that's the So onto the hilum. First advice is you locate bronchus. The bronchus is the easiest thing to locate, right? Because it's thick, it's cartilaginous.
You can't touch it.
No, you cannot touch it. But
So how do we know it's
so you will know if it's cartilaginous, if it's cartilage, if it's like that, or it's transparent in the middle, like that, and it's more structurally sound. It's more, if you just see it, it's stronger than the other holes. Okay. And most of the distinction of your arteries and veins, especially in cadavers, you won't know if it's a vein, if it's an artery, more on the location of it. Because especially even if we have anatomic variations, most of the time, people or humans have the same, they have the same location of the arteries and veins. So as I said earlier, more anterior it is, and so inferior it is, it's a vein. More anterior, vein. more posterior artery. Okay, so you know that this is posterior, right? So what's this? So that's an artery. So if you can see the artery, it bifurcates again. It supplies the lower lobe, the upper lobe. So this part here going to the upper lobe, so those are the superior pulmonary artery or superior lobe, superior pulmonary arteries. Inferior, okay? So that's it. But we don't actually the blood supply of the going inside the lungs, we don't name them na just the main arteries and veins. So this is what's this? This is a vein. First, you have to know if it's a vein or an artery. So what's this? Is it a vein? Where is it located? Is it upper, lower? Upper. So it's a superior pulmonary vein. So left superior pulmonary vein. Lower than that, wala may artery diri. We don't have an artery. So you know that immediately that it's an artery. That's a vein. Okay? So it's in the inferior man. So left inferior pulmonary vein. So you put everything just to be sure. You have to write fast. Okay? Then this hilum is basically a junction or for dila anastomosis. It's like the fusion, di ba? You have in your thorax, you have your parietal pleura, then your visceral pleura. Your visceral pleura is in the surface of your lung. Parietal is in the surface of your thorax. So your thorax is closed system, is a closed system. So everything will go somewhere, right? So everything will fuse here. Okay? So you have a ligament here. It's called pulmonary ligament. So everything here is a pulmonary ligament going down here. So that's the pulmonary ligament. The pulmonary ligament is also called pleural sleeve. Pleural sleeve. Because visceral parietal pleura, right? Becomes sleeve. If it's fused, like that. It's the sleeve. Pulmonary ligament. Yeah, the hilum. So you know that this is the hilum. Okay? Sleeve. What? In the middle of the there. Let's say they want you to answer pulmonary artery. They will put it in the middle. Okay? But I think in my experience they didn't place it in the superior pulmonary artery and inferior, no, just in the like this. In my experience, but I think last year, I don't know what happened, but maybe they put, I don't know. But just to be sure, just so you know, there's a superior and then there's an inferior. Okay, so we're through. So run through. What's this? Left. Complete na. So that perfect.
Pwede ba daw ka mag-center kayo?
Center. Left. First thing, you should know if it's left or right. If you don't know, mali na yun. Because if you think that this is the right, so this is the more anterior part. So you might think that this is a vein. So it's wrong. So, no, first advice, know if it's left or right. So sharper, anterior, posterior, curve. So if you imagine it like if it's standing like this. So if I'm facing like this, it's anterior. Okay. So to the hilum, maybe they will just put it like this. But in the bronchioles, I think they will be specific. They will really, that's why they cut it like this. They will put it here in the middle. So what's this?
Superior bronchus. Left superior bronchus.
Left superior lobar bronchus. Then in the inferior, Left, inferior, lobar, bronchus. So you write everything. Okay? Not left bronchus. No, mali na. Okay, tama left. Correct bronchus, but what specific area? And the left,
Secondary, but for the primary, it's only left bronchus.
yeah, main bronchus is the primary. Secondary is the lobar. Because the main bronchus doesn't have lobes naman. Because it's the main trunk. So the lobe or the secondary one has the lobes na. So the lobes is this lobe. You know that it's lobe. It's what's this fissure? Oblique fissure. So this superior lobe, inferior lobe. So lobe. So the lobes is actually it's like an anatomic in surgery more on when you resect the lungs, they will just resect is it either lobe or lobectomy or segmentectomy. So that's why it's important to know, that's why they really want you to know the segments. Okay? So last na ng segments because it's hard man to. It's you know naman no in ang course review na lang after before we go to the right. So it's like this. So if it's like this, if they point here, what's that? Left, apical.
Superior.
No. First, let's be systematic so that it's easy. So segment, lobe, lung. Okay. What segment? Superior, apical segment. Apical segment. What lobe? Superior lobe. What lung? So, apical segment, left superior lobe, left lung. Okay. Then here, posterior segment. So posterior segment, superior lobe, left lung. Here. Pwede po kama. Dire pa. Wala na off. Dito na kama. Apical segment, kama. Superior lobe, kama, left lung. So, then here, anterior. So anterior segment, superior lobe. Okay. Then, the apico-posterior. Dili na sa middle kay dagan man gud na pag check ninyo na siya yung mga there will be corrections. So dili na siya uniform to all. So bonus siya. They don't doctors doesn't like you to have bonuses. So they will really point to kanang to everyone ba. It's true to everyone. So they will really point to the middle. So kung mag-point sila here, so anterior na siya. Here, posterior, apical. Then, unlike the right, the left has the lingula, di ba? This thing. So, in this area, that's the lingular side. So, there's a superior lingular and then inferior lingular. So, if they point here, superior lingular segment, left lung. Then here, inferior lingular segment. Very good.
Is it really like that or like that? Superior and inferior?
Superior is like if you see the book, the atlas, if you remember the atlas, they will if you make an imaginary line here, like here, something like this. So this is the inferior side, this is the superior side, because if you cut it like this is the anterior, posterior, apical. So there only this triangle is the lingular side. So if you have the lingular side, superior, inferior. No, even if they put it like this, I still know that this is the superior, then this is the inferior, because you know that this is the parts, the areas. So five segments, five. Okay, so 10 segments each. Even in the right lung, there's still 10. Okay, so in the lower than the oblique fissure is the lower lobe. So what area is here? They will point it here. Superior segment of the inferior lobe. Very good. Then, my trick is I make an imaginary line here. Here. So everything here lower than this, because you know that this is the posterior, the superior, right? So everything here has a basal in it, lower. So anterior, basal, lateral, basal, posterior basal, medial basal is here. Because you cannot say that there's medial basal here, because this is the lateral side of the lung. So it's inside. So it's here. Okay? So there's 5 again in the lower lobe. So what's here? Medial basal. So if you imagine, why did I know that this is the lateral? If you imagine, if there's a medial side here, the lateral will be in the opposite side, of course. So it's in the middle of the anterior basal and the posterior basal. Easy, right? Perfect na. Perfect na tomorrow. So make an imaginary line. Actually, gross anatomy requires a lot of imagination, especially when you go to GIT. They will fuck up everything. Then imagine there's 7 meters of small intestine, and then there's 60 centimeters of your large intestine, 40 to 60 centimeters. And then if they put it like, diba? So you have to know it gross. So what you see, not the position in the actual anatomy, because they don't want you to have a correct answer. They really want you to fail. That's what you will think when you have exams or lab exams. The doctors doesn't want you to pass. They will want you to fail. So to pass, overcome. So use imagination. So review. Make an imaginary line. What's this? What's here? Okay, perfect. So, manata diri.
But don't you have to say the medial basal of the left?
Yeah, of the inferior lobe. The important thing is the segment, the lobe, and then the lung. Inferior lobe. Don't forget. Even if it's like this, you know that this is the inferior lobe. Even if you put it like this, this is superior man. Oh, you might get confused, and doctors like to confuse you. They will put it like this. You will think, this is the superior lobe. Tago dyan sa taas. It's on top good, it's superior. Oh. Why is it the inferior? Because if you imagine that the normal anatomic side of the
During your time, Kuya Angkor have mentioned that in left lung, there are portions in the segments where it is combined, like the apicoposterior.
Yeah, that's when they put it in the middle, I think. But Angkor is ahead of me. When in my time, they put it in the
Specific.
specifically in the area. But you have to know also what's the apicoposterior, the combinations. More or less, apicoposterior is more here.
Yeah.
Here. It's just, I think I don't know how it is in actuality, but I think they really fuse, especially in the superior lobes, because in surgery more of the cancers of your lungs more on the superior side. So they will do a segmentectomy in the apicoposterior. Okay, so they will do an incision like this. Like this. So like this. Like this. Apico here going to the posterior. So they will not cut the anterior.
Another question. If the proctor will going to tag it here, can we answer apicoposterior segment of the superior lobe of the left lung?
Maybe, but I think just to be apical na lang. Just do the apical.
right in between.
Because if they want you to answer posterior, they will put it here. Yeah. But pins are small man. So it can only the apical, it can only point one thing, right?
There is no possibility like if a doctor would like 2-3 pins and identify that reason like segment also.
What?
Like
They will put
2-3 pin at the one.
no, only one pin. Because the pins will have numbers. So as you go on, you will have numbers. Sometimes it will be put like it has a yarn, then there's a number. Then you will locate, and then you have only, I think, 40 seconds for 5 items each. 45 seconds na
For 5 items.
for 5 items. For 2 items. It's easier for you. In our time, it's 30 seconds, 5 items.
Yo! Are there clinical questions?
No. Only gross. No clinical questions whatsoever.
Identification.
Yes. And then they will not if the sample, if the gross anatomy is this, they cannot point the parietal pleura, so don't answer parietal pleura because the parietal pleura is hugging the the visceral pleura there. It's hugging the lung. Okay? So it cannot be ano ba kanang this one it's the visceral pleura. But if I dissect that, even the parenchyma can be ano ba. So they cannot tag the parietal. Okay? So no parietal pleura. Only grooves. Visceral pleura. Only grooves. So you know the grooves, right? Okay. What other grooves that Angkor told you again? Esophageal, more esophagus, more posterior. So if this is the left, posterior, trachea, anterior. Normal anatomy.
Behind the aorta.
Huh?
Esophagus is behind the aorta there.
No, it's upper. Okay? Because normal in your mediastinum, if there's an aorta, your esophagus will not go with your aorta. It will deviate from it. So if this is the esophagus, most likely, if the aorta is going here, the esophagus will go anterior or other areas. It depends on the body, anatomic variations. Okay, but in the apical portion of your left lung, there will be grooves for it. So you know that the groove for here, posterior side is the esophagus, anterior trachea. But groove for so on and so forth. Groove for the descending or thoracic aorta. Groove for so they will not put it here or here. They will put it in the middle of the arch of aorta. So groove for arch of aorta. Okay. Descending is here, or you can also say thoracic aorta, but not only aorta. Okay, you don't need to say left lung because the right lung has a groove for aorta also of your thoracic aorta. So just say thoracic. This that groove for.
Okay, left lang naman.
Naman po sa right. So it's not unique. So it
What's
doesn't.
the answer of the descending? A full name.
What?
questions based on bones too, right?
Yeah, do you have ribs? Can we get the ribs? Your coverage tomorrow, even the clavicles can be asked. So you have to know the parts of the clavicle.
She's asking
right.
what's the full name of the descending aorta? That's already the name.
That's the name.
Aorta.
Groove for, because this is not the descending aorta, this is the groove. So you have to groove for descending aorta or groove for thoracic aorta or
Pero
whatever.
kami thoracic din ako abdominal.
Yeah. Because ang aorta has parts, lagi, they have parts. So arch, ascending, arch, thoracic or descending, and then after the hiatus in your diaphragm, it will be the abdominal aorta. So you have to specify. So if you just say groove for aorta, what kind of doc will ask you? What kind of aorta? Descending, arch. There's a lot of names. So you have to be specific. Okay? So are we through with the left? Okay na?